Hey guys, this is Dr. Hub. Today we'll look at what is the Risser sign. So the Risser classification, this is completely used in the ossification of the iliac apophysis. So it is used in terms of the ossification. So ossification of the iliac, of what? Of the iliac apophysis. Apophysis. So this is to grade the remaining skeletal growth. So to grade remaining skeletal growth, remaining of the skeletal growth, and the ossification progresses from the lateral to medial. So the ossification, if you see, it moves from the lateral to the medial direction, and it is again divided grade wise. So in terms of the grade 1, in terms of G1, that is grade 1, the ossification, it lies about lateral 25%. Now G2 is about the lateral 50%. Next is the ossification of the lateral 75%. Next is again lateral, and this will be 75%. Then comes the ossification of the lateral. So this is 3. Third is the lateral 75%, and 4 will be the lateral 100%. 4 is nothing but 100%. Then we look at 5. 5 is nothing but the fusion of the ileum, fusion of the ileum. So to learn and grow daily like this, please do subscribe.